Good. Excellent. All right. Well, good, very early afternoon, everyone. I'm Gary Harbison, the Executive Director of the Missouri Coalition for Oral Health. And as you just heard, we are recording the webinar. It will be posted on our website at a later date, probably right under the area where you saw the notification for the webinar on the main page of our website. That's oralhealthmissouri.org. I wanted to make a special note that it's my understanding there is a nationwide emergency alert test this afternoon scheduled for 1:20 p.m. So there's a pretty good chance everybody is going to have their cell phone doing something at about 1:20, and we'll expect a little bit of a disruption there, but it is a test. It's not an actual emergency, so try not to let it be too distracting for you. I'll give a brief introduction to the coalition, but first I want to thank Department of Health and Senior Services Office of Dental Health for sponsoring this webinar and the 3 other webinars in the summer series. And again, you can find information about those on our main webpage. I also want to thank the Missouri Primary Care Association and Karen Dent in particular for providing CEUs for dental professionals. Please watch for a post-webinar survey and be sure to complete it. We'll provide a CEU code for the survey at the end of the webinar today, and you will need this to complete the survey. If you do not get the survey email, be sure to check your spam folder and see if it went in there. It does come out from the email address that you ought to get, but it does happen. And of course, if it's in spam, it would be nice if you'd whitelist our domain. But in any case, contact us if you can't find it. And I just want to remind you, we'll do a few reminder emails for survey completion, and you'll get those even if you finish the survey. And my thanks especially to our speakers for sharing their expertise and experience and taking time out of their busy schedules to be here. Ashley will do introductions here in a minute. Many thanks to the attendees for being here. We will generally be using the chat feature for questions, and we'll do our best to get to all of the questions. We do want to encourage questions. We have, as you've seen here at the beginning, switched kind of from a webinar format to a little bit more like a meeting. And please remain muted if you're not speaking, but you may be able to do questions verbally. The coalition is a nonprofit dedicated to improving Missouri oral health. MCOH has only 4 staff members, but we have members throughout the state who work together to meet the many oral health challenges of Missouri. We are supported by memberships, donations, the Health Forward Foundation, the Missouri Foundation for Health, and the Missouri Department of Health and Senior Services, and we appreciate support from all those sources. Most available numbers indicate that Missouri has tremendous oral health challenges. In fact, it's fair to say that Missouri oral health is poor. Rural areas of the state have limited or no access to dental care. And that's also the case in some of our urban and suburban areas. Maintaining good oral health is essential to overall health. Poor oral health interferes with work and school. And believe it or not, it can lead to death. This has actually happened and has been in the media in some other states, not in Missouri. And let's hope we don't see that, but I am quite sure that it's already happened. You can find more information and data on the MCOH website and through the Department of Health and Senior Services website. Just search Missouri Oral Health, and you should be able to find both of those locations. I wanted to mention a few of our accomplishments. In the past, we were able to reinstate dental benefits in Missouri Medicaid, providing coverage for about 350,000 Medicaid eligible adults. Of course, that population will be expanded now with the Medicaid expansion going forward, and we look forward to having those people have access to dental care. Probably many of them have not had access for quite a while. There will be access issues after that, though, as there continue to be for the 350,000 adults, and that is the provider community isn't able to provide quick, easy access at this point in time. Some of our other accomplishments, we've worked with the Missouri legislature to pass significant legislation, including what we call the fluoridation notification law, and legislation to allow for development of teledentistry in Missouri. We worked with the legislature to establish the Oral Health Caucus, an important vehicle to raise awareness of Missouri oral health challenges. We hold an annual Missouri Oral Health Policy Conference. It was virtual in 2021, first time we've done that. We think we're probably going to be in person back in March of 2022. You can watch our website for information about that. The coalition has long supported reducing or stopping the use of tobacco as a key part of achieving good oral health. We have supported proposed tobacco taxes in the state, and we were the first statewide organization to endorse Tobacco 21. With that, I'm going to turn it over to Ashley Herman, the Community Outreach and Project Development Director with the coalition.
Thank you, Gary. I want to take a minute and again thank our speakers and all of our attendees today. We have two fabulous speakers who are going to present on tobacco control and oral health this afternoon. The first of which is Valerie Howard. And Valerie is the Assistant Bureau Chief with the Bureau of Community Health and Wellness. She's also within the Tobacco Prevention and Control program with the Missouri Department of Health and Senior Services. Our second presenter is Kim Robertson, and she is a Communications and Promotion Specialist within the Tobacco Prevention and Control program, again with the Missouri Department of Health and Senior Services. Valerie, you should be able to share your screen and get started.
Okay, good afternoon. Can you guys all hear me? All right, wonderful. Good afternoon. And like Gary and Ashley said, thank you so much for being here today. We're excited and appreciate the opportunity to visit with you about tobacco use and oral health. And Ashley came up with a wonderful subtitle, The Brilliance of Tobacco Cessation for Improved Oral Health. And we really appreciate you guys taking your lunch hour to do this today. So again, thank you. We're just going to jump right in. So talking about tobacco use and oral health, we want to talk a little bit about our program. So the Missouri Tobacco Prevention and Control Program resides within the Department of Health and Senior Services. And our mission is to improve health by promoting and supporting tobacco-free environments and lifestyles for all Missourians. And so today, Kim and I are going to visit with you, and Leslie's with us as well. She manages our quit line. And is going to help us with questions in the chat. And we improve health by promoting and supporting tobacco-free environments and lifestyles by the four following goals. We work to prevent initiation of tobacco use among youth and young adults. And we do that one of the ways that Gary mentioned through legislation. So access laws requiring raising the age limit for being able to purchase tobacco products, and educating youth about the impact of tobacco use, or a couple of strategies we use to prevent youth initiation. Another goal we do is promoting cessation among youth and young adults and adults as well. And we manage the Missouri Tobacco Quit Line as one of our primary vehicles to promote quitting, along with education and media campaigns. A third goal is to eliminate tobacco exposure to secondhand smoke. And we do that also by promoting and promoting the awareness of the impacts of tobacco secondhand smoke on others, and strategies such as policies to be able to keep people safe, community ordinances, and local business place-based policies to protect people from secondhand smoke exposure. And then the overarching goal that kind of sort of weaves throughout everything we do is to eliminate tobacco-related disparities. And we're going to talk more about that as we go. So our objectives for our time together today is to know the burden of tobacco use and its impact on oral health, to understand the role of healthcare, particularly oral health practitioners, in helping patients quit, becoming aware of available resources to help tobacco users quit, and knowing how to refer a patient to the Missouri Tobacco Quit Line. And so to get started, talking about the tobacco and the burden of use and exposure, we do have a little polling question to ask you. So if you wouldn't mind responding, what % of your patients use tobacco products? Just an estimate. If you had to guess, some of you may be tracking that and know exactly what it is. And for the rest of you, you could just guesstimate the percentage of patients that you see annually who use tobacco products. Okay, Ashley, do we have has that been enough time?
That was. It looks like about 55% say 21 to 40% of their patient population uses tobacco products.
Okay, all right, well, thank you. 21 to 40%? Okay.
Correct.
All right, so that's helpful to know. We'll keep that in mind as we continue here. So tobacco, the burden of tobacco use and exposure. So what's the big deal? And you guys know this firsthand because you see it, right? But let's talk about the burden nationally as well as in Missouri. And so nationally, about 34 million adults smoke cigarettes. And in Missouri, that's 1.2 million. We'll talk about the state percentage here in just a little bit. And then there's 58 million non-smoking Americans who are exposed to secondhand smoke. And in Missouri, a little over 822,000. Annually in the United States, 480,000 people die, including from secondhand smoke, from tobacco-related illnesses. And when you think about that, just look at how many people have died in the life of COVID. It's close to 613,000 as of August 4th. That's quite a few, 480,000 every year from tobacco use. And in Missouri, that's 11,000. And nationally, we spend $170 billion to treat smoking-related illnesses. And in Missouri, a little over $3 billion. And we also know that tobacco use is the leading cause of preventable death, disability, and disease. So when we look in Missouri and adult tobacco use compared to the nation, nationally, about 14% of adults are smoking cigarettes. And in Missouri, it's 19.6%. And so Missouri is, we rank number 10 in the country for adult tobacco use. And we're going to talk a little bit more about why that is here shortly. And then when we look at e-cigarette use, again, you can see Missouri is a little bit higher than the national rates, 4.5% nationally and 6.2% among adults in Missouri. And smokeless were more than twice the national use rate at 5.6% compared to 2.4%. So let's talk a little bit about youth use and what that looks like in Missouri compared to the national data. And so cigarettes, our first column here, cigarette use among youth has gone way down. 7.6% nationally, this is 2019 data, and 6.5% in Missouri. And so our numbers here are a little bit lower across the board, except for smokeless. But as we know, smoking cigarettes has been replaced by electronic cigarettes. Where cigarettes used to be a gateway drug, it's been replaced by e-cigarettes. The other thing we know about e-cigarettes is that it's an equal opportunity product. So used to be cigarettes were known to be used by a certain group, our crowd. E-cigarettes are being used by all peer groups among youth and adolescents. And this data is specific to high school students, I'll add as well. And so nationally, we have about 1 in 5 high school students that are using electronic cigarettes. In Missouri, it's about 1 in 4. And as you can see, our use for smokeless tobacco is a little bit higher than the nation. And so let's talk a little bit about the burden or populations that are disparately impacted by tobacco use. And so across the country, we have some populations, again, that are more impacted by tobacco use and exposure than others. Nationally, this is the data. Folks with lower education, folks that are below the poverty level, adults 25 to 64-year-olds, men, uninsured or Medicaid, people with disabilities, behavioral health disorders, LGBTQ. And then we've got some geographic disparities as well. And the Midwest and South are primarily what comprise that, Missouri included. And then we know the strategies to reduce cigarette smoking overall. And that's implementing smoke-free laws, which again is one of the things that we help communities work towards, running mass media campaigns. And we'll talk about that here in a little while through the National Tips campaign. And raising the price of tobacco products. We know that Missouri has the lowest sales tax in the country at 17 cents, and making quit help easy and accessible. So that's what works, and this is who's impacted nationally. For Missouri, you can see our rates here. Again, we're at 19.6%, which puts it at number 10 in the country for adult smoking. Of that, 45% are unemployed. Uninsured, 40%, less than $15,000 a year at 39%, and Medicaid enrollees at 40.6%. And that's down from 50% about a year ago. And I included this image here of equality in smoking and disease, nobody wins, because women are another population that's disparately impacted by tobacco use. And in Missouri, particularly pregnant women. In Missouri, pregnant women smoke at twice the national average, women smoking during pregnancy, about 15.9% compared to about 7.2% nationally. So why is this? And this is a place where you can either let yourself off mute or just type into the chat. Why is Missouri number 10 in the country for adult use? And why are certain populations impacted more than others from tobacco use and exposure? Yep, low tax rate. Oh, I'm not in presentation view. Hold on, can you guys not see this?
Yes, we can see it.
Can you see the slides, but not my presentation notes?
You can see both your notes
we can
and the slides
You
and then
can?
the next slide.
It's not terrible though. It doesn't hurt.
Oh, well, but that's no fun. So I didn't see the chat earlier. You want me to stop and stop that? That's probably a little annoying.
I personally think it's okay. It makes your slides a little bit smaller than maybe we'd like, but I think it's fine. It's not like you have anything bad in the notes.
But it's odd that it's doing that. I don't know how to fix it. Can I try? That'd be all right.
Yeah, it is absolutely fine for you to try. We did have this on one other webinar where somebody ran into that issue. We're not quite sure how to control for it.
Okay, so give me just 1 second. Is that better? Can you see both now?
We do not see your notes now. No, it's just the slide.
Oh, wonderful. Thank you. And I'm sorry I didn't see that chat earlier. Okay, thank you. All right, education levels and healthcare disparities, Ruley. Absolutely. Low tax rate. What are some other reasons why Missouri is number 10 in the country and certain populations are more negatively impacted than others or use at higher rates?
Well, this is Gary. I think there's cultural issues with tobacco use that I think certain populations within Missouri. And Missouri, I always think of Missouri as being a very diverse state. But I think there are certain populations, smoking is the norm and it's what people do. And so they go along with that.
Very good. Thanks, Gary. Other reasons you can think of? Lack of smoke-free protections. Yes, for sure. Thank you very much for that. Absolutely. So Missouri is one of just a handful of states that's part of that geographic disparity where we saw the Midwest and the Southeast, because we're one of few states that don't have a statewide smoke-free law. And so that obviously contributes along with the low tax rate. Other things you can think of as far as why some populations smoke more than others or use tobacco products at a higher rate? So I'm just going to mention the tobacco industry. The tobacco industry and their marketing really impacts use. Yeah, it's a cultural thing for sure. Role modeling, very good as well. Absolutely. And yeah, so there's a whole lot of things that contribute to this and help keep it in place. And, you know, the industry does have a role in this issue, in the way that they market the product to people who use it. And that's part of the issue with electronic cigarette use and how the youth use became an epidemic. It kind of snuck up on folks. So those are all wonderful, wonderful responses. Thank you very much. So let's talk a little bit about what types of tobacco products there are. So we've got electronic tobacco products, and we're going to talk more about electronic cigarettes here in a minute, but e-cigarettes, vaping devices, and heated tobacco products. And then we've got our standard combustible tobacco products, including cigarettes, cigars, and cigarillos, hookah, pipes, roll your own, and biddies. And then our non-combustible tobacco products, those are those that you don't smoke, are inhale, but those include smokeless tobacco, snuffs, nicotine pouch, and dissolvable tobacco. And the industry is always coming up with new ways to get nicotine into our systems and new devices in which to do so. And they are working on actually, at this point, synthetic tobacco, synthetic nicotine for use. That's on its way. So that's a little bit about tobacco products. So when you think about tobacco, what's in tobacco? So you got some ideas on kind of what is included in tobacco that might be harmful in addition to the nicotine. Well, let's take a look. So borrow this slide from smokefree.gov. 60 plus. These are typical household chemicals that can also be found in secondhand smoke and in cigarettes. And so when you look at that, ammonia, butane, cigarette lighter fluid, acetone for fingernail polish remover, benzene that's found in gasoline, carbon monoxide, paint thinner, arsenic, lead, and a number of other products, as you can see down here on the bottom. So these are some of the chemicals that are in, common household chemicals. When you think about a cigarette, there are over 7,000 known chemicals that are included, and those are put into the body. At least 69 of those chemicals we know are known to cause cancer. And those that are coming into the person's body and into their lungs are also in the secondhand smoke. Those are also being impacted into others as well. And so we know that if you live with a smoker or you've been in a place where there's been a lot of tobacco use, and you take a picture off the wall and you can kind of see the outline of that picture there to see some of the impacts that it does have. We're going to talk a little bit about electronic cigarettes just a little further to talk about that issue because it is an epidemic with youth. And so we already talked about 1 in 4 Missouri youth, high school students, are using electronic cigarettes. Most e-cigarettes do contain nicotine, although the perception is that they don't, or that you can get e-juice that doesn't have any nicotine in it. But most of the nicotine products, most of electronic cigarettes, nicotine is included. And we know nicotine is a highly addictive drug, and it can cause harm to the adolescent brain development, which their brains continue to develop until their 20s. There's a lot of other harmful substances in electronic cigarettes besides just nicotine, and some of those that we talked about in the previous slide. And when you think about the way those are used, so where you smoke a cigarette, you are inhaling, aerosolizing that into your lungs through that the vaping device, and that goes directly into the lungs. And so when you think about all of the chemicals that are including the nicotine that are in that e-juice, that's going directly into their lungs. And if you think back about a year ago, this time, there was a national outbreak called EVALI. Remember that? And it was a big concern. People were dying. People were ending up in the hospital. Nobody knew what was going on, but it was electronic cigarette or vaping product use associated lung injury. And it took a long time to figure out exactly what that was, but we saw people all over the country that were vaping nicotine through their vaping devices, their electronic cigarette devices, that were getting hurt. And when you think about putting those products directly into your lungs, it makes sense that you might have a lung injury or other issues as a result of putting that into your lungs. What we ended up finding through that investigation was vitamin E acetate ended up being the underlying issue. And you think about that, it's like an oil. So when you vape that oil into your lungs, our lungs weren't designed to have oil in them. And it kind of sort of did some major harm there. So the marijuana use, THC was the primary agent there that was causing that, but there was also a number of hospitalizations from just plain nicotine vaping. Young people who use e-cigarettes may be more likely to smoke cigarettes in the future. And so where we talked earlier about e-cigarettes have kind of replaced cigarettes as first-time smokers, oftentimes kids who start using e-cigarettes end up using smoking cigarettes as well. And sometimes they end up using both. Cigarettes are cheaper than electronic cigarettes. And in one pod, one of those little pre-filled liquid pods, there's generally the equivalent of about a pack, the nicotine level of about a pack of cigarettes. We know some kids that are actually vaping about 2 pods a day. When you think about that, that's 2 packs of cigarettes. And if they're smoking cigarettes on top of that as well, you know, we're talking about some pretty highly addicted young people. And with electronic cigarettes, because of the way they're developed, they can be used pretty much, they can get hits constantly. So they don't ever have to go through that negative withdrawal experience that you start, your body starts to experience whenever you are coming off of the product. It tastes good and it's easy to use and you can hide it pretty easily. And those are all issues that have contributed to being an epidemic among youth. And so the other thing we know about e-cigarette use is it's unsafe for kids, teens, and young adults, for pregnant women, and for the adults that don't currently smoke, it's not recommended that they start using e-cigarettes either. We also know that e-cigarettes are not an evidence-based cessation aid. There's just not been enough research at this point to know that it's an effective to help people stop smoking. And we also know that additional research can help understand the long-term health effects. It's a relatively new product and we don't yet know what kind of long-term effects that's going to have, particularly on adolescents. We talked about the harm on the developing brain. We don't know the impact that's going to have longer term to those kiddos. Let's talk about the risks of smoking. And so we talked about it harms every part of your body. So cancers, chronic diseases, we're going to talk here in a minute specifically about oral health, but As you guys can see, all of the issues there related to smoking and the damage that it can do to your body. Type 2 diabetes, cataracts are on here, stomach ulcers, heart attack, doubles the risk of a heart attack, COPD, prematurely ages your skin from 10 to 20 years, and inflammation and decrease in your immune function. And that's one of the things that we were trying to educate people about during COVID-19, folks that have compromised immune or lungs are at a higher risk of having a longer, more difficult recovery with COVID-19. And that includes people that smoke. So specifically talking about, because you guys see this in the work that you do, what are some impacts of tobacco use on oral health? What is it that you see in your patients that use tobacco? And again, if you want to take yourself off mute or pop your responses into the chat. Deeper periodontal pockets, bleeding pockets, retarded healing from surgery, staining, teeth staining, mouth sores, bad breath, discolored teeth. Anything else? Excellent. Dry mouth. Oh, lack of smile. Is that because they're like embarrassed because of the color of their teeth, or? Yeah, okay, that's helpful. So you guys probably see a lot. Absolutely. So yeah, for sure, what you just said, all of those things that you just said, absolutely, and can cause oral cancer, gum disease, and other oral health problems. And you guys have just named it. And so this is one of our tips from former smoker ad participants, talking about losing all of her teeth as a result of her tobacco use. You guys probably know this as well. 90% of people who with oral cancers have used tobacco. So how can you tell? You can tell from all these things, right? That your patients, how you can tell if they're a smoker. Are there some other ways that you can tell that they're a smoker? Implants fail. Good. That's not good, but thank you for that response. Implants fail more. How can you tell if your patient smokes or uses tobacco? Are there other things in addition to what we just said? Nicotine stomatitis. What is that? Smell it on their clothes? All right. Thank you. All right, so people who smoke are 3 times more likely to lose all of their teeth, and particularly in older adults. So 4 in 10 older adults who currently smoke cigarettes lost all of their teeth. Untreated tooth decay is higher in people who smoke cigarettes, and I think you guys mentioned that earlier as well. Among adults aged 20 to 64, over 40% who currently smoke cigarettes had untreated tooth decay. So you guys, as oral health practitioners, you see this firsthand. So let's talk about oral health professionals' roles in helping patients quit. So we've got another little poll here for you. If you could answer or tell us, percentage of your patients that you screen for tobacco use. Okay, has everybody had enough time to answer the poll? Over 80%. Oh, you guys are good. Excellent. Wow, wonderful. All right. So kudos to you all, because you all, as a oral health professional, are in a unique role to influence your patients by having these conversations with them. So we just want to talk a little bit further about that with you. So most tobacco users want to quit. Most people who use tobacco know that it's not good for them and they want to quit, and they've attempted many times. In fact, over 50% attempted in the past year. Nationally, it's 57% in the last year, and in Missouri, it was 55% just this past year. Most people don't get it on the first try. It usually takes multiple attempts to get a permanent quit. The average is 8 to 11 attempts. And so you may remember a few years ago, the FDA did a campaign targeting middle-aged adult smokers. Every try counts, kind of like each try gets you one step closer to that permanent quit. Over 40% of adults who smoke do not receive advice to quit from a healthcare provider. And brief advice from their clinician, you guys, as their dental professional about smoking cessation yields a 66% increase in successful quit rates. Again, you guys have a big influence on your patients. 3 in 5 adults who ever smoked cigarettes have quit, with less than 10 successfully quitting each year. So we're going to listen to a little bit from our former U.S. Surgeon General, Dr. Jerome Adams, talking about the role of healthcare professionals in helping their patients quit.
I'm U.S. Surgeon General Dr. Jerome Adams. As healthcare professionals, we play a critical role in helping our patients quit smoking. Quitting is hard and is a process, not a one-time event. The good news is we have proven treatments, including counseling and medication, that can help our patients be successful. So ask all of your patients about their tobacco use. Advise them to quit and connect them to treatment that can help them quit for good. Ask, advise, connect. It's one of the most important things we can do to help our patients live longer, healthier lives.
All right, so we just heard from the former U.S. Surgeon General, and he called it Ask, Advise, Connect. The brief intervention that we use is called Ask, Advise, Refer. So the 2 A's and the R. Then it sounds like the majority of you are doing this with your patients. You're asking about tobacco use. You're screening them for use. Just by simply asking, do you currently smoke or use other forms of tobacco, including e-cigarettes or vaping? And for young people, they may not necessarily understand the term e-cigarettes, so vaping or even juuling might be a more familiar term for them. And then advising them to quit. If you find out that they do use tobacco products, saying things like quitting tobacco is one of the best things you can do for your health, and I strongly encourage you to quit. And then asking them if they're interested in quitting. And if they're interested in quitting, whether they are really or not, you can always give them information for help, because they may not be ready the day you ask them, but you can kind of sort of plant that seed and give them some referral information, such as the Missouri Tobacco Quit Line, which we're going to talk more about here in just a minute. So if they change their mind in the near future, that they have a resource to contact. And we're going to, like I said, talk more about that here in a minute. So it sounds like a lot of you are already screening your patients and having these conversations. So again, this is another opportunity where you can take yourselves off mute or chat into the box. What's your experiences have been like in having this brief intervention conversation with your parents, asking them about their tobacco use, advising them to quit, and then referring them to assistance? What experiences have you had with screening patients and having these conversations, and how has that gone for you? Next success, patients need to be ready to quit. Patients are polite, but aren't really interested. Some have gone well. It does take them a while, okay? What about with youth? Have you had the conversations with youth? Are you screening youth for tobacco use? And what have their responses been? Is anybody screening? Who's screening their youth for tobacco use and having these conversations? Are you, is that included in that 80%? Youth included? They're embarrassed. Thank you for that response. Others? Are they honest? Can you tell if kids are using e-cigarettes? Conversations about smokeless tobacco and oral cancer with photos have been impactful. Very good. Thank you, Guy. As their dental professional, when you're dealing with young people who've disclosed that they use, do you then have conversations with their parents about that as well? Or how do you guys handle that with kids? Because typically when a parent brings a kid to see you and if they have a cavity, you would tell them, do you share that information if it's shared with you as their oral health provider, or how does that work? Okay. Ask permission to discuss if they are amenable to cessation strategies. Thank you. So you ask them if it's okay to talk to their parents about it and to give them cessation resources. Yeah. Most of our screening for tobacco use is by intake paper. Oftentimes their parents filled that out, so it can be harder to tell if they use. Yeah, absolutely. Some of the signs that you noted for adult use with the impact of tobacco on oral health, can you see that in kids as well at this point? Or they're too early in their use for you to see the impact? Too early in their use, usually tell from the person. Yeah, yeah. And e-cigarette use is real hard to tell. Oftentimes it is odorless, and you know, you're not going to see that same kind of stained teeth and, you know, the gum damage and those kinds of things from the electronic cigarette use. So that might be a little bit more difficult to know if they're using that. So thank you guys for your responses there. Let's talk a little bit more about cessation. So some evidence-based tobacco use and dependence treatment. So what works? What's effective? We already know that it takes multiple attempts to get to a permanent quit, but what's effective to help them? So counseling and medications used together can double a patient's chance of quitting. So they're both effective used individually, but used together, again, double their chances of successful quit. Combination medications, a combination of long-acting like patch along with short-acting nicotine replacement therapies like Lotion or gum increases their chances of success. So combination therapies, the long and short-acting NRTs, and the other most successful cessation medication is varenicline or Chantix, and that's used by itself. And then tobacco quit lines are also an evidence-based tobacco use and dependence treatment strategy. Proactive counseling from quit lines increases the chances of quitting when used alone or together with cessation medication, as well as web-based cessation and texting services can also help. So on CDC, Centers for Disease Control and Prevention, Office in Smoking and Health, there are a number of resources for healthcare providers, including oral health providers, for more information and tools and resources to help you have these conversations with your patients about tobacco use. So there's clinical tools that give you more resources, more about how to have those conversations. There's quit lines and other cessation support resources. There's additional videos on there for you guys to talk more about your role and how to have those conversations with your patients, as well as videos for your patients that they can go and see about what to expect when they call the quit line, for example, what kind of are cessation medications helpful for me, would that help me with my quit? There's a lot of very short little videos under this portion of the resources. There's more information on electronic cigarettes, just to keep yourself informed, and resources for you to give to your patients about e-cigarette use. There's patient resources there, and those are the things that you can download and hand out to your patients about the impact of tobacco use on their health, and cessation resources that are available. Additional education and training resources for yourself, and then a specific based on care setting. And we also have links to, we have a handout that has tons and tons of links to this information and additional resources and tools that can help you in your role in helping your patients quit. And so at this point, I'm going to turn it over to Kim, who's going to talk to us about additional Missouri resources for helping your patients quit. Kim?
Thanks so much, Valerie. Can you guys hear me well? Yes. Okay, wonderful. So again, my name's Kim, and I'm here to talk to you about the Missouri Tobacco Quit Line and some other resources that are available to you. So next slide. As Valerie said, studies show that people who use quit line services can double their chances of actually quitting. And we know it takes several attempts, so we want to increase the chances as much as possible. When you combine the quit line counseling and quit smoking medications, those NRTs that Valerie referenced, you can triple the rates of success here. So we really think that this is a great option for your patients, and we encourage you to use it. The quit line is a free service. It's available to anyone 13 years and older, and it can help anyone who's struggling with addiction to cigarettes, e-cigarettes, or even smokeless tobacco. And we can even help out people who are former smokers, who are worried about trying to avoid a relapse, and family members or friends who have a person in their life who smokes and want to help that person quit. So we have a lot of different options of helping people out with the quit line. Users can call 1-800-QUIT-NOW, and they'll be routed to a trained, specialized quit line coach and this service is available 24 hours a day, and it's completely confidential. So they even, if you're a teenager and you want to call the quit line, you don't have to worry about, somebody finding out about it. So it is confidential. When someone calls the quit line, they can receive up to 4 free phone calls with a certified quit coach. We also have web-based coaching options. And there's a texting program. So if the patient doesn't feel comfortable talking on the phone, they can still receive motivational messages and videos and encouragement throughout their quit line process via text message. Each patient can receive up to 2 weeks of NRT or nicotine replacement therapy, along with a quit guide and everything they need to have a successful quit attempt. Next slide. We have some specialty services because, like Valerie pointed out, we do have some groups in Missouri who are impacted at a different rate than others. So right now we have a specialty program for pregnant and postpartum women, and it offers 10 calls. And we also have a program that's special for young people. And so we have quit line coaches that are trained in youth addiction, and young people can call in and get some specialized services there. We also offer individual services. So if somebody's not quite ready to complete the entire quit line program just yet, we have things like text message program, emails, nicotine replacement starter kits, just to get people started. If they're that patient, like you said before, maybe you can tell they smoke and they know they need to quit, but they're maybe not quite ready to make that attempt yet. And if someone chooses one of these individual services, they'll also receive a follow-up call from our quit line just to check on their quit attempt and see how they're reacting to the chosen program that they picked out. So our newest feature, and we're very, very excited here about this feature because we know that teen vaping is on the rise. So it's a text message program for youth who are dealing with addiction to e-cigarettes and vaping products. It just launched on August 1st, so it's a brand new program, and we're going to have lots more materials coming out available to you guys on our website soon about this, but we're super excited about this. Teen vaping is a huge problem in Missouri, and we want to just help young people to kick this habit before they get addicted and become addicted adults. We know that teens are oftentimes don't want to pick up the phone and call somebody. So this message or this program is completely through text messaging, and teens just text vape free Mo to 873373, and they connect with direct coach who has specialized training, and they receive, curated content and games and quizzes and videos to help them and encourage them along their quit program. We also have a brand new program for parents, and it's going to launch on August 18th. So we're really excited about this too, because we know a lot of parents are struggling with how to talk to teens about e-cigarette use. And it's the website is vapefreelife.com. And again, all of this information is in a handout, so you can have direct links to all of this stuff. So the site helps parents to learn the warning signs for teens who are using, and to help figure out ways to motivate teens to stop using e-cigarettes. It also offers support for any parents who want to learn how to talk to their teen, or if they just don't know much about e-cigarettes and they want to learn why teens vape and why it's a problem. So it's going to be a great resource, and we think it's really needed right now for parents in Missouri. The Missouri Tobacco Control Program also offers an online training for healthcare providers. So if you want to learn more after this training, we have more resources on our website for you. This online training goes more in depth on the brief intervention and how to have that conversation with your patients. It talks about FDA approved medications and how they help people quit. It talks about how to make pharmacotherapy recommendations and the benefits of the Missouri Tobacco Quit Line, and how to refer patients to cessation resources in your area. There are continuing education credits available for this online training. And like I said, it's available on our website, and that information is in the handout. And there's also some additional modules that kind of dig deeper into other topics. So you can check those out at your leisure. There's a module on pharmacotherapy dosing recommendations, so if you have questions on that, and considerations for our behavioral health population, and different considerations for pregnant women in our community who smoke. So like I said, if you'd like additional training after this session today, I encourage you to visit our website, and if you have staff that isn't able to attend today, it's a great resource for anybody who's patient facing in your offices that may be having these conversations with patients. Next slide. It's very, very easy to refer a patient to the Missouri Tobacco Quit Line, and we encourage you guys to do that. I'm going to walk you through the steps on how to do that. And you can see on the slide, these are kind of some screenshots from our website. So our website is youcanquit.org, and you simply go to this website after you've had this brief intervention conversation with your patient. And it's really best practice to have the patient in the room still with you, so you can just make sure you get their contact information correct, and you get their consent to have someone contact them from the quit line. So you click refer a patient. It's a button at the top of our screen. And then you type in the name of your clinic. If you've never referred a patient to the quit line, you will have to type in the name and phone number of your clinic. But if you have referred somebody in the past, it'll auto-populate all of that information for you. So it just makes it that much faster. And then you'll also have to certify that you're covered by HIPAA because you can't contact anybody unless you certify that. After you've entered all your practice information, we'll need some information on the patient that you are referring. So you'll just need to put in your patient's name, date of birth, zip code, and phone number. And down here at the bottom, there's this little question that asks if the patient is giving consent to be contacted. And we do need to make sure that we point that out and definitely click that button and make sure that we know that they've agreed to be consented, because we don't want to be calling anybody that hasn't agreed to be called. And then you just simply click the submit button and your work is done. A Quitline coach will directly contact the patient and take it from here. And the nice thing about the Quitline is, as a provider, you will be notified when contact is made with your patient. So you'll be notified of what the status is on that patient, and that way you can note their file, and the next time they come into your office for a regular checkup or a visit, you can ask about their progress and make sure you're keeping up with that. Next slide. We have some wonderful Quitline materials available for free on our website. And this is some examples of some different things we have out there for you. This is a rack card on the left here. And it's a card that kind of shows you everything that we've just talked about with the Quitline. And so it's a nice piece of material that you can give to patients after having this conversation. We also have a smaller version. It's a business card size. And it's available, like I said, for free for you to keep in your office. And it's just a simple thing to hand the patient when you're having this conversation. And, you know, maybe they're not ready to have the Quitline call them just yet, but maybe they want to take this home and look it over, and maybe they'll call the Quitline later. So that's a great resource for you. And our website and all that information is also in your handout. The CDC also has some wonderful resources for patients if they have more questions, or if they're just not quite ready and they want to do some of their own research. The cdc.gov is their website, and patients can learn about you know, what it's like to call the Quitline, and you know, the 10 questions that people ask most about Quitlines and things like that. So it's a great resource if patients just have more questions and aren't quite ready to get the Quitline to call them just yet. There's also some great resources on the American Dental Association site. And the American Dental Hygienists Association actually has recently partnered with the CDC Tips campaign, and they're bringing these awareness messages to their followers. So their website has a ton of great information, and they've been promoting the tips campaigns on their social media and on their website, and also in their newsletter. So that's another great place if you want additional information after this webinar. 2021 marks the 10-year anniversary for the CDC Tips from Former Smokers campaign. And I know you've heard us reference it several times. This has been a very successful campaign for the CDC. It profiles real people who are living with serious long-term health effects from smoking and from secondhand smoke exposure. The tips features compelling stories that really show the toll that these conditions take on people and the people in their lives, you know, their family members and their loved ones. The goal of one of the goals of this campaign is to engage healthcare workers just like you, and to encourage you to help your patients quit smoking using these messaging. Scientific studies have shown that these hard-hitting media campaigns are very effective in helping people to quit smoking. And then campaigns that evoke emotions like these personal stories and feature graphic images of, you know, what it means when a person smokes their whole life and how that can affect their health. These images actually increase Quitline calls and Quitline website visits. So we see a huge uptake when these messages are being aired. And I'm sure if you've ever watched any program, you have seen these lovely messages. But yeah, they really are impactful, and they really do show what can happen if you smoke cigarettes. Next slide. these are some examples of some posters and some different resources that the CDC has out there on their website. These posters can be ordered from the CDC and you can hang them in your offices to warn your patients about the harms of smoking. The CDC also has some ready-made social media messages that you can use on your own social media channels. And they also have short videos that can be downloaded directly from their website that you can use in your office waiting rooms while customers are sitting there waiting to come back. And then all these resources, like I said, they can all be accessed on cdc.gov. And now we are going to watch a video, one of the videos that we've talked about from the TIPS campaign, and listen to Brett's tip. I can't hear that video. I think you're going to have to come off mute.
Tip to you is my name is Brett and I used to smoke. I quit, but not until I got a serious gum disease. My tip to you is your smile says a lot about you. What does this say?
I think Brett's message is really powerful.
Visit cdc.gov/tips.
And I think that, you know, like we said, these powerful images of the effects of smoking really do paint a picture in patients' minds and maybe be the reason that, you know, someone decides to call the quit line. So I think it's really powerful. So this concludes our presentation, our formal presentation on the brilliance of tobacco cessation for improved oral health. We hope that after listening to this presentation, you know more about the burden of tobacco on Missourians and you can understand your role in helping patients to quit. And then you know where to get resources and where to find free stuff that's out there that we have prepared for you, and how you can refer patients to not just the Missouri Tobacco Quit Line, but also cessation resources in your area. On behalf of the Tobacco Prevention and Control staff, I want to thank you for attending today and for your passion in keeping the people of Missouri healthy. We're going to open the floor now for questions, and you guys can put your questions in the chat box, or if you want to come off mute, somebody can read your question out of the chat box. Our contact information is on the screen right now. And if you need anything from us, please feel free to reach out to us. We are here to help you, and we really want you to be successful in having these conversations and helping your patients to quit for good. So we're going to check out the chat box and see if we have anything in there. We'll give you guys some time to type in your questions in there.
I had a question about dual use of smoked cannabis and smoking, or THC in the e-cigarettes or the vaping. Are you going to add anything to kind of address that co-use, possibly codependence?
That's an excellent question. And actually, thank you for asking it. We've been actually working with our Quitline provider. We contract for the Quitline services, and they are adding some new features to their program here in the next year. And we've encouraged them to consider addressing marijuana addiction as part of the cessation services that they include, because of that dual use we know is an issue. At this point, they are not planning on including it, but we will continue to encourage them to do so because it is a growing issue and a growing need. But right now, at least for the Missouri Tobacco Quit Line, that's not something that is addressed in and of itself. However, the dual use, they can get assistance with, quitting, smoking of a product per se. So whether it's nicotine or marijuana, but we don't have specific services for vaping marijuana or smoking marijuana. Leslie, do you want to add anything else to that?
So I
No, I think you covered it.
So I would just like to throw in there that because there's medical marijuana that is smoked, the go-to for tobacco is quitting, but the go-to for smoked cannabis is not, if it's for medical use. So I think it muddies the waters a great deal. And I'm looking forward to seeing what both the CDC and Missouri Public Health does to kind of navigate those choppy waters. Because most people who use cannabis aren't necessarily addicted to use it.
Good points. Thanks for your question. Other questions? How do you recommend opening a conversation about smoking cessation? So it sounds like a number of you that are already screening your patients for tobacco use. And so is that one way when you see it on their, what is it, an intake form? If they've indicated that they're a smoker, then do you follow up and have that conversation with them when they're seeing you for their visit? Like I see here that you check that you're a smoker. At kind of that opening, is that how you're doing it now? And if not, that would be the recommendation to ask them, right? So, you know, especially as their oral health provider, you know, that's a really easy way for you to have that conversation. As your oral health provider, I have to ask, do you use tobacco? You know, because of the impact that tobacco use can have on your dental health, right? Or your oral health. You know, I'm concerned about that, or whatever the case may be, but kind of starting it with, as your healthcare provider, I need to ask you. And then if they say yes, then again, it's the same response. Well, as your dentist or oral health hygienist, you know, I need to advise you to quit, you know, because it's the best thing you do for your health, particularly your oral health. Leslie?
Valerie, I would also add that the online provider training that we talked about earlier, it has a couple of videos with a healthcare provider doing that brief intervention with a patient. I think one of the scenarios is a patient who just is not ready to quit. So if you want to check out that those little video vignettes in our training, I think that might give you a good visual and a good example of some different scenarios of how you might handle that with your patients.
Guy, thank you for your response. So Guy is saying that he usually ties the discussion to oral health goals like implants or prio problems. I saw one of those little video vignettes Leslie was talking about earlier this week where the patient was there for a tooth whitening procedure. And they were talking about, well, you know, if you're a smoker, that, you know, and you're paying all that money to have your teeth whitened, you know, that tobacco stain is going to continue to stain your teeth. So, you know, have you thought about quitting? Have you tried quitting? So that's an excellent intro, talking about it related to their oral health goals. Other things that you've tried to begin the conversation with your patients about their tobacco use? Other questions you have about the burden of tobacco and your role in helping your patients quit? Well, again, on behalf of Kim and Leslie and myself, we want to thank you for your time, for your attendance today, and for your active participation really appreciate your contributions to the conversation, to the discussion. Ashley's got a handout that has a lot of additional resources that we'll make available to you after, and we'll make the slide presentation available as well if you're interested in having that, but it sounds like it's been recorded, so that will be available through the Whole Health Coalition's website. And again, if you need anything from us going forward, just let us know, any one of us, Kim, Leslie, or myself. And thank you so much for the great work that you're doing. We really appreciate your role in helping us to make a dent in tobacco use and dependence in Missouri by talking to your patients about their use and encouraging them to quit. So Ashley and Gary, we'll kick it back to you.
Well, I just want to thank everyone for being here today, and certainly thank our speakers. You did a great job. You're getting a lot of comments in the chat about what an excellent job you've done today. So I think with that, I'll give Ashley the opportunity for last words, and we'll say goodbye to everyone. Oh, I do need to give you something though. I need to give you the code. Just give me a second. The CEU code that you will need for the survey is public health. So the CEU code is public health, and you watch for that that survey email with the link, and please do take time to fill that survey out. Even if you don't want CEUs, we like to know how we're doing and how we can improve our webinars. We do a lot of this type of presentation outside of the conference really throughout the year, and so it's very important to us that we get that feedback from you all. Ashley?
Yeah, Gary, I think you wrapped it up wonderfully. I want to thank Valerie and Kim and Leslie again for their great presentation and excellent information. Again, that CE code is public health for when you get the email from us. We ask that you get that filled out. Excuse me, also in that email will be the presentation from today, as well as the handout with additional resources that Valerie was just talking about. And the one final thing I want to mention is when you close the webinar today, there will be a pop-up with a few questions that Valerie and Kim have provided. We do ask that you complete those just so that they can have some individual feedback on their presentation as well. With that, I thank everyone for attending, and we look forward to seeing you at future webinars. Have a great afternoon.